Today we're diving into the very basics of vitiligo. As always, this is for informational purposes only. Please do not use this as medical advice. Thank you. Hi everyone, today we're going to talk about vitiligo, a very common condition we see in our dermatology clinic. We're going to dive into the very basics today. So vitiligo, what is it? It's a chronic skin condition characterized by progressive loss of natural skin color, resulting in those white patches on the skin. In this very quick talk, we're going to talk about the epidemiology, what do the numbers say, the potential causes, associated conditions, commonly affected areas, and types of vitiligo. So, epidemiology. Vitiligo is relatively common. Even though these numbers, 0.5 to 2% prevalence, don't seem very high, this means that millions of people worldwide experience and battle vitiligo. The average age of onset is between 10 to 30 years of age. Average age of onset is between 10 and 30 years of age. I have many patients who have vitiligo starting in their 50s, 60s, and even 70s. So it is not uncommon to get it outside of this age range. Again, it can affect people of all types, of all creeds, of all colors. In a recent 2023 study, there was a suggestion that there was an increased prevalence in the Hispanic or Latino population, but vitiligo can affect all types of people: Asian, Caucasian, African American, Hispanic, or Latino. So, causes of vitiligo. Well, we know it's an autoimmune disorder. So it's the immune cells attacking the melanocytes, the cells that make pigment in our skin. There's likely a genetic factor, given that vitiligo tends to have some type of genetic or familial link. It doesn't necessarily mean that if your family member has vitiligo that you'll get it, but there is a stronger association between family members. Potential environmental triggers. This isn't as well understood, but there can be potential triggers like chemicals, injuries, or sunlight, and oxidative stress. We know that underlying all of this, and typically underlying most autoimmune conditions, there's some component of oxidative stress occurring in the body that leads to this autoimmune phenomenon. So, the one association we're going to dive into today is thyroid disorders. When there's an autoimmune condition, sometimes there can be an increased prevalence for other autoimmune conditions. For example, hives, also known as urticaria, can lead to an increased prevalence of other autoimmune conditions such as thyroid disorders. People with a type of alopecia, called alopecia areata, may have an increased prevalence of vitiligo and thyroid disorders. So, similar to these findings, we find that patients with vitiligo have a slightly increased risk for thyroid disorders. So, it is important to get your thyroid examined and to check the levels in your blood. Areas affected by vitiligo. Vitiligo can affect any part of your body. It most commonly affects the face, the neck. It can affect the distal extremities, meaning the hands, the feet, body folds like the armpits, the groin, skin creases, and even other areas like the ears, the eyes, and the mucous membranes like the mouth. There are many types of vitiligo. The most common is something we call non-segmental vitiligo, and that's what most patients have. Non-segmental vitiligo typically occurs with symmetrical patches on both sides of the body. Not always, but it typically has some symmetry to it. Again, this is an autoimmune phenomenon, and there are various types, like those happening on the face and the groin, in the mucosa, generalized throughout the skin on the body, and in some patients, the entirety of their skin. The other types of vitiligo are less common. Segmental vitiligo typically occurs in children. It is typically one segment of the body and does not typically spread to other parts of the body. So finally, vitiligo. There are multiple potential etiologies or reasons one gets vitiligo. It is hard to decipher a specific cause for vitiligo onset in each individual patient. It's important to diagnose vitiligo early because we can use oral medications, topical medications, and light therapy to improve vitiligo and potentially halt its progression. But in the future, I would bet within the next 10 and probably within the next 5 years, there will be additional treatment regimens for vitiligo that will be efficacious, safe, and great for the millions of people that battle vitiligo each and every day. If you or someone you know has vitiligo, feel free to share this. Feel free to like the video. It helps me disseminate this information to others that might benefit from it. As always, if you have any questions or concerns, or if there's anything that you'd like me to cover, please do reach out.